I'm going to introduce Mike Shorey, who is the CEO of Shortcut Medical Group, and they've studied the semaglutide market and legal requirements for the sale of semaglutide and through pharmacies and other avenues. Okay. And since February 15th, when they entered the market, they've added over 70 pharmacies that are now providing the product through his service. And for that purpose, Mike has over 20 years in the healthcare industry. And he worked with Henry Schein for a 20 years, Mike?
Yeah, about 17 years in and around the Henry Schein people all the time, yeah, in the healthcare sector.
All right. So, Mike, take it away, and let's show these people how they can make some money with semaglutide.
Right. I think Ken would love this, what's about to happen. So if you guys can just mute for a second, and I'm going to get you up and running on a presentation. Can you all see that?
Yes.
All right, let me just minimize this here, move that over to there. Okay, so Shortcut Medical basically is a company that was created specifically for the semaglutide, tirzepatide market, what's going on in terms of injectables, how it relates to the Novo Nordisk's diabetic drug, the Eli Lilly diabetic drug, and the law specifically. For us, we've done a very deep dive into this to the point that all of our network, our marketing, things that we've put together has brought us to a point where we can safely provide a pharmaceutical grade, FDA registered product to people that is not something that is compounded with other sorts of additives that has created sickness, where the FDA has had to step in and deal with certain situations, or where there's been lawsuits from Novo Nordisk, which most people think has to do with product, but it really has to do mostly with the fact that marketing is used incorrectly. So I'm going to cover a number of things today to just give you information. Once again, if you can just mute your side, and then I'll open it up for questions afterwards. But if you have a question that you want to desperately jump in, just unmute and talk to me. That's the whole purpose of our time together. So let's start off with this and talk about a 503B and a 503A and how that relates to the law, how it relates to the supply of a product. I don't have to over-explain this, but I think when you look at the schematics of this, it's very simple to understand that a 503B is in a different class of control and oversight as what a 503A is. I mean, 503B is certainly an FDA oversighted facility where a 503A reports to its boards. It's a little different, and we have found, and you have probably heard and seen, 503As that are compounding, and that's by and large where the problems have been with 503As that are compounding and the product is not up to speed, or more importantly, those 503As cannot really supply the purest form of product, for the lack of a better word. But there it is, very clear and simple, that when it comes to liabilities, availability, safety, and quality, a 503B is a little different. Well, to me, a very big difference. And that's why the law has stipulated that 503Bs are the ones to be looked at when it comes to semaglutide. Now, let's look about the product for a second. There's a storyline behind it. You all probably know that Ozempic had a product, or rather Novo Nordisk had a product called Ozempic, Eli Lilly had a product called Mounjaro, and in these products they found ingredients that helps tremendously with weight loss, and everybody was excited. They tried to get these products for weight loss, and obviously insurance has denied that. That was number one, which became extremely costly for for a lot of people, but it also became costly when it was even approved for pharmacies because there wasn't enough insurance coverage and money had to come out of pocket. What that led to was the law, and this is important because probably 90% of the calls we field or we deal with first can we get the law out the way? The law that I'm about to give you are not hypotheticals. Friar Levitt has given their write-ups on the law, and the number one FDA DEA law firm in America called Hyman Phelps McNamara has also reviewed our labs, their paperwork, their imports, as well as all the conditions of how they're doing business, and we've passed with flying colors. And at any time, if anybody wanted to speak to the Hyman Phelps, more than welcome to have that happen. Let's look at the law. The law says that if there's a shortage on a certain drug, it may be prepared by a compounder. That means if there is a shortage, which there is since 2023, tirzepatide and semaglutide are on the shortage list. And what that does opens up a little specific door, which says, therefore, the new states that are 503B. Guys, if you can just mute for us, please, because there's stuff coming through. Let me just go down here. So again, so therefore, the new law states that a 503B compounder can use raw API powder imported. This is important by an FDA wholesaler. It's going to open up here for a second.
Is that color?
Yeah.
113.
Give me 1 second here. Guys, could you please mute for me? We have Sun Life, Michelle.
It's not gel though. It's regular. It's regular, right? Regular. I want to make sure.
I'm just trying to mute people myself now. Sorry about that, guys. Hopefully it works. Okay, so the next thing is, so the 503B compounder bringing product in. Oh, I don't know. Tony, can you help with this? I'm getting a lot of background noise. No, there we go. All right. So therefore, you know, the law states that if a product comes in through an FDA wholesaler, it can be compounded for sale. That's not a problem. This is another law. One of the conditions that must be met for a drug compounded by a 503B outsourcing facility to qualify for the exemption that has been written up by the FDA is that that product compounded will not be sold or transferred by any other entity than that 503B facility, which means the 503B can go ahead and sell or transfer this product to another entity. I will already say right here, from that point on, the product may not be resold. The only selling mechanism behind any semaglutide, tirzepatide in the United States is from a 503B compounding outsourcing facility. 503As cannot sell this product. That takes us to this next part of the law, which opens up the door for pharmacies. Wholesaling and compounding drugs is prohibited, absolutely, but it is not deemed wholesaling when the outsourcing facility that distributes said drug is actually providing that drug or that compounded product to health clinics, physicians, etc., and in the red there, or to a pharmacy, federal facility, or licensed physician, which subsequently dispenses the drug pursuant to the prescription. This is information directly out of the FDA draft, so it's not a law made up by us, it's the FDA law you're looking at. Quickly going to the compounder, because it's now important as to, okay, who do we really work with and what makes it different? Well, here it is. We work with 2 compounders. They're the only 2 compounders in the United States that actually provide an NDC number with everything they provide. So both our 503Bs are nationally accredited. They're both on the FDA accredited list as a manufacturer, as a 503B. Both use robotic technologies. So we end up with a good pharmaceutical grade product. Every batch is quarantined, follows FDA guidelines. It's not a salt form, which is another big reason the FDA clamped down in the beginning and still do, is that imports that have been brought in actually is a salt form semaglutide. This is not a salt form semaglutide. It has no acetate in it, and it cannot get you unless it comes through a VARD accredited wholesaler, which is what we use. The beyond use date is 180 days. And it is in full adherence, obviously, as GMP, and they provide a COA and NDC with everything that is done. So we've made sure that at our company, we didn't just go and accept anything on the market. We stepped back, we went and legally looked at everybody, we assessed everybody, and in the end, I believe we've made the right choice. And it's proven to be the right choice, because even though there are some people still trying to change the pricing structure out there, realizing, and most of our clients realize, it's better to keep safe and buy a good, solid product than take a chance on a $5 difference on something, and then people get sick. So who can buy from a 503B? Let's just go to the trail and the journey of what happens. Product comes in internationally, it gets to an FDA-approved wholesale company, which is what we work with. That product gets given a personality, it gets given a presence of face, and it is regulated. It then comes to a 503B or a 503A sterile compounding pharmacy who's able to buy the product as well, but not resell it. They can make product, and then they have to get scripts to fill the product, which obviously, in my opinion, defeats the object for pharmacies. But the product at a 503B, the API is compounded, the 503B makes a finished product, and that product can then be moved to the public. And so a 503A compounder, healthcare facilities, including pharmacies, can purchase from a 503B for the dispensing to patients. Here's another little schematic which kind of explains it. 503B makes product, and the 503B may sell to a 503A, a hospital, a Medi-Spa, a doctor's office, clinics, and pharmacies. From that point on, all of those people have NPI numbers. From that point on, it's very clear that you cannot resell the product, but you may charge for scripting, and that is what most of the pharmacies, since we focus on pharmacies today, that's what not most, but all of them are doing. I'll put it in there again, product cannot be resold. Basic understanding of ordering here is very simple. All can advertise that your pharmacy can fill a semaglutide script. It doesn't really matter where the advertising comes from. You are legally allowed to have product in your facility. You're legally allowed to take in a script, and you're legally allowed to dispense it. So wherever that prescription comes from, whether it be a doctor's office or it be called in or a telemed call in, it doesn't matter. You have the right to dispense it directly to the patient, who will take it home in an insulin type syringe and do self-administration of the drug. And I'll show you a prescription in a moment. You will have the stock in place, right? There's a 5 milligram by 2 ml vials. The prescription sets the program. As you know, I don't have to go over that. And a single vial to the PCA network today is $145.50. And because of the way the labs are working now, we've taken the credit card fees off so that it's not added on top of your purchase price of $150, but it ends up being included, and you end up paying $150. Almost every pharmacy out there right now is sitting around about $380 to $400 for a dispensing cost. So to the gentleman that spoke earlier, depending on knowing your vision and your traffic and how many people are looking for this and your marketing, we are finding that on average, we've got people coming in now, they've done 20 vials, in 2 weeks, and all of a sudden they've got 20 vials a week going, and the message is picking up. And I think that's about 160% ROI on a vial, which is really a decent margin, and brings back some lost revenues. So if you get a prescription, comes in something, it looks similar like this. I mean, you know these things better than I do. And the patient will simply get a process that the doctor would give through on their prescription saying, administer the following ways. They can get their vial, they can come back and get their next vial. They don't need to take all the vials at one time. And as they finish off each of their vials, they come back and you just reissue their vials that they need. The ordering options here, I want you to have a look at what we have. So we have a number, for example, at the top left, there's a 5 milligram by 2 ml, which is what we have. It's 10 vials in a box. And as we then go down, we have a 25 vials per box. It's 5 milligrams by 2 ml. And then on the far right, top right there, which is important to look at, we have bigger vials, 10 mg by 4 ml and 20 mg by 4 ml. This is typically used by people that are doing administration of a program inside their office. So we have a clinic now today that has placed an order to take 3 boxes a month, and that clinic runs its own program, administers the injections in its clinic. But for the pharmacies, it's simply a scripting out. I have plenty of marketing available for you, but when it comes to marketing, I'm happy to help you guys with marketing and the message of the marketing. But there's some key points, right? As a matter of fact, when I started off in this and I started talking to people, they knew me as Michael O. And I only, believe it or not, found out today why they called me Michael O, because they call me Michael Ozempic, because in their minds I'm related to Ozempic, which I'm not. But that was how they could correlate between all the Michaels that were in this in arena. So it's not an Ozempic product. It's not an equivalent to an Ozempic product. This, when you say things like that, that's when problems begin to happen. Ozempic's a diabetic drug. This is a weight loss drug using semaglutide. It's really that simple. It's not something you can say for sale because, as you know, we cannot sell it. And we don't guarantee results, even though there's great results coming. And most importantly, the biggest thing is obviously do not say semaglutide comes from factories Novo Nordisk, which some people have said, but it's not the case. Comes from the same country, but not the same as Novo Nordisk. Marketing, I have plenty of materials to provide to you. I'm not going to belabor this too much, but if you need help with marketing, we can help all day long. I want us to look quickly at registering and ordering. We have a CRM in place. I've just pulled a couple of documents out. So we'll give you a CRM to go into. It's a top there. It's for your network. You'll fill in your registration. Everything will be filled in, and it is self-explanatory. It will lead you step by step where you have to go. At the bottom right here, you can put in your state license and your DEA license. Once that's all put in, you can then go in and place an order. As you can see, it says request form, right? So request form means I'm requesting something from you. We're not saying that you're placing online orders, even though it ends up being that. And the way we have to do that legally and the way we do it is that your request that gets placed will go directly to the lab, because all business is done between the lab and yourself. That means your order will go there. I'll make sure it gets in their hands. I'll verify the paperwork that it is correct. The lab will get it. The lab will charge you. The lab will send you a tracking number, and your product will arrive to you. And all that happens between you and the lab. Our job is purely a facilitator to make sure this all moves accordingly and according to plan. And then you'll get an account. I mean, I've just printed one here. You'll get a printout of your order form. And we fill these orders typically in 24 to 48 hours. That has never been a problem yet. And it's been going like this for 3 months perfectly. So I think that is the end of my presentation. If there's any questions, I'm open for questions now. And let me just hand it back to you first, Tony. Tony, you there? Ken, can you hear me? You got to unmute. Everybody's got to unmute.
Okay. Yep, I got you. So the order form that you referred to, the first two are what we're going to be looking at. The first on your order form, what we're buying is the.
You can't even say that Jeffrey Epstein was involved with our government. It's facts. It's not a questionable thing. It's not a questionable thing. It's fact. Bill Clinton was on his plane 26 times. He was the president of the United States at the time. How dare you? It's facts. Like,
sorry, I'm a little lost. Who's talking now?
It's not like if people are making that up. Like, how can he pretend like he didn't know that? He acted like he didn't know that. That's insanity.
All right, I'm muted.
I don't know.
I don't know what that's about. It's RX for all. I'm lost in your conversation. Sorry, I've just muted you. Please text me.
Okay,
right.
my question was, when we're ordering from you,
Yes.
obviously there's several different opportunities, but I think the first two was for us as pharmacies, since we're not going to, unless we have a practitioner in our office, we're not going to be doing a weight loss injectable program. So what two we would typically be buying the 10 vial.
Right. So most people go with their first order. And this is an important part to understand. I try and say that if you don't have traffic that's already asking for a weight loss program, if you don't have traffic that has been trying to get weight loss through their insurance with using a branded drug, if you don't have that, if you don't have that type of message and conversation going on, then you're going to have to advertise to get that market built. A lot of people we've worked with, I would say almost 80% already saying, I have people asking this question all the time because they see a lot on the news. So what you would end up doing, Ken, is simply buying, when you're ready, buying 10 vials in a box. And when those scripts come in, you will fill them and you will mark them up and fill them accordingly. But again, I don't know everybody's place, position. And there are some people that script out at 500 because they're in a high net wealth environment and they feel they can do it. That's entirely in your hands.
Gotcha. Okay, so we cannot sell to a prescriber. The prescriber has to send the patient to us.
100%. That's very important.
Okay, can we send out more than a month's supply? Absolutely, I would imagine so.
So once again, that's obviously is completely between you and the doctor. The doctor feels sometimes the dosages are higher. It depends on the size of the person and the program they're in. That'll determine the dosages. So they might need to take 2 vials at one time. So yes, it's all relative to what the doctor decides. I mean, you simply have the product in-house that you can give them, and they are going to take that, and you're going to charge the upmark fee.
Is there going to be a pen or anything in the future or no?
Yeah, so I can answer that question. So pens aren't necessarily the best approach. Believe it or not, the cartridges that are in there don't always work properly. They jam, they don't discharge properly. So many times the pens have to be sent back. The answer to that is, as we speak right now, there is a pen. It's already been made. I have seen it. It hasn't been accepted by Blue Cross Blue Shield, which is somebody who's looking at it, because the weight loss market isn't being addressed by insurances. But the pen would pretty much be an insurance-based thing, because if somebody's going to buy a pen or that type of look and feel, the price goes up considerably. I think a pen is going to be close to $600.
For our cost or retail?
No, that'll be retail, yeah.
Okay.
Our cost, our cost is still going to be significantly higher to what you have here. There's nothing on the market right now. I've looked at preloaded syringes. I've looked at, different approaches to actually providing us. This is the most cost-effective way to provide a weight loss, system to people.
Gotcha.
Mm-hmm.
What do you find is the most effective way to advertise, or because you said we're probably going to need help in advertising marketing. What have you found to be the most successful, or what's been the most?
I mean, I can answer that in a very odd way. The most successful marketing is when the marketeer, meaning yourself, is hands-on to the marketing. I know it's an odd thing to say, but there's been so many variants. I have one group that actually had script pads made up and given to all the doctors. That was their choice. So I don't know your area, so I can't speak to it, but I certainly think that something in your facility, some degree of flyer should be up. I think that the people in your area, doctors, should be at least notified that you can do this. And I think that anybody that you have as a client base could be told that it is now available.
Should we say something like generic semaglutide or?
No, it's not no, you cannot use that. It's not a generic, it's a compounded semaglutide. That's the only word we can use for it.
Got it. Okay.
Yeah.
Mike, this is Tony. Unfortunately, I had a power outage here, so I was offline for a little while. And I'm now on my cell phone versus my computer.
No problem. No problem.
I think you have a question also from Naziri.
You said how a pharmacy is marketing this? That's Nazir. They're doing flyers. As I said earlier, for Ken's discussion, which you probably heard, everybody's very different. So when you know your market, I think to me what's been important is that call it the A to Z, the stepping into this. Clearly, I know that when the information is brought to the public or the information is brought to the market or your town, that it is available, that in itself, that word of mouth starts moving pretty quickly. Every town has its own marketing approach. I mean, you might have a television program that you could put product onto. You could, you can go to a gym, for example, and put up a flyer. I mean, all over gyms today, you'll see the skinny shot, and you can call somebody who's a telemed person who will then say, right, I can get you on board, and they will then script it out to some pharmacy. There's so many variants that everybody tries something different. I think to me, the start point would be at least a flyer in your facility, and at least using whatever network you have to inform them that this is something you offer and all they need to do is bring a script. 45% of the population tend to gravitate to the need for this. And what I'm finding is nothing has gone downhill. Everything has gone uphill every week. So people are reordering now, and the orders are getting to the point where it's bigger and bigger all the time. So there is success, but from a marketing standpoint, well, it's entirely up to you. It's hard for me to tell. I'm here to help you, of course. Can Alabama pharmacies order this? There's no state at this point other than California that cannot order. However, people like Mississippi and Texas, I found some interesting things there that the boards have had a few things to say. I've addressed both state boards with my paperwork because I think that both state boards are not reading and studying the actual law effectively. So they're blocking pharmacies with no real right reason. So some of the pharmacies have taken it up in a more stringent way to say, there's no need to block me. There's no reason behind it. So there is some process going on for that to be uncovered. But so far, there's no problem with Alabama. We can cover all states. Can California pharmacies, there's another question, can California pharmacies answer? No, California cannot get on board with this just yet. You have the strongest laws that block anything from coming in. However, which doesn't help you, if there was somebody who needed an individual script, we do have a network of groups or pharmacy network that can supply to the individual person, but that doesn't support what you're doing. I will say that come June, July, we are in contract with probably what could become your first 503B for this product in California, and then the doors will open. Let's see, did I miss anything here? No, we're all good.
I'm back. Power's back on.
So I think I've answered most questions. Is there any other questions, guys? I mean, for me, one of the things is, and ladies and gents rather, let me say this, that if you need any additional discussion, I'm here. Don't mind taking personal calls and going through certain things that might apply to you personally and how you're trying to get business done. We have about 70 pharmacies in literally the last, I would say, month and a half that are now signed up and are doing very well from this. I was offered an opportunity to take this to the Walgreens, et cetera, and I turned it down. People go like, why would you do that? Well, because I think it takes away from small business. That's my thing. And so I decided to stay with pharmacies, the networks, the doctor's offices, and because there has been obviously a time through the whole Novo Nordisk Ozempic thing where the pharmacies lost money, they didn't make money. So, I will keep up at this and for at least 6 months to see how we can work together.
Michael, you have another question, I believe.
How long does the product last in a fridge? Great question. So the beyond use date on this product, let's go through it. So the two labs have a little bit of a distinct difference. Actually, both labs do not have to transport product on ice. It's not a requirement, believe it or not, but if you want it, some pharmacies do, we do that. Once you get the product, it doesn't have to be refrigerated for up to 15 days, and it can sustain a temperature of close to 77 degrees. But you're going to put it in a fridge in any case. The real question that comes after that is what happens when we puncture the vial? Well, we follow the norm of all processes, 28 days from the day of puncturing the vial. But yeah, cold storage is always recommended.
Michael, so you said you'd be taking calls if people needed to speak to you?
Absolutely, yeah.
Do you want to share your number?
Sure. It's 203-856-7537. 203-856-7537. If you could just text me first, because I get so many calls, and just say, being on the call with you at Tony, and then I'll happily call you back.
Do we have any other questions out there? Well, Michael, thank you. We greatly appreciate it. We will be sending out a link to this webinar that we recorded, so you can go back and listen to it. And you do have another question there.
Yeah, so can you send us some of the marketing stuff? Yes, we can do that. What I'd like to know is just a little more about what it is in the marketing you're needing. So marketing stuff is pretty broad. If you're looking for a flyer, we can certainly help you with that. If you're looking for something that's like a banner or something, I can move you on to somebody. Yeah, that seems like it. Any more questions?
No.
No? Perfect.
Thank you, everybody, for attending,
Thank you.
and have a wonderful weekend. Great Patrick's Day. And you'll be getting an email from us tomorrow morning with a link to this recording and also a link to sign up and create your order page.
Perfect. Thank you for having me, Tony. Much appreciated.
All right. Thank you, Michael. Greatly appreciate it. Bye now.
Bye, everyone.
Bye, everybody.